Very good afternoon to you and welcome to What Media. Just before I start, a little bit of housekeeping. If I could ask you guys to do me a favour, and as you join, tell me where you are in the world, where you're watching from, what it's like where you are in terms of COVID-19. Are people listening? Are people wearing masks? Are people wearing gloves? That would be really, really appreciated. Just while we're waiting for a few people to join, I should probably introduce myself. For those of you that are new to the page, I'm Dr. Kish and We've been doing this for a good 5 years now. What Media started as a result of the junior doctors contract dispute. So I was one of the media junior doctors then. We talked a lot about the NHS, making people aware of what a precious resource it is. And then we were mothballed. I mothballed it for a while, deliberately, because I didn't think there was that much to comment about. However, since March, we've resurrected ourselves. There's a group of us, not just me, I'm the front of it, but there's a group of us working behind the scenes who are working really, really hard to get relevant content to you guys, the great British public, but also international public, because over the peak of COVID-19, What Media's peak has been 1.2 million people, and that's organic reach. Thanks for liking, that's really helpful as well. Keep liking, keep sharing, keep commenting. Hi Mags, where are you, where are you from, what's it like where you guys are? And also if you guys in the comments could talk to each other and get to know each other, that would be really, really helpful. So, as I was saying, thanks very much guys. At the peak, we got to 1.2 million, that's organically, and that's incredibly difficult nowadays because for Facebook to get your content to people, you have to pay for it, and that's where the crowdfundings come in, and I will talk a little bit about that at the end of the video. So it might surprise some of you that are watching that actually in this video I'm actually going to praise some of the stuff that the government have done today. I think it's really, really important. It's gorgeous, isn't it, Tracy? I just nipped into London, cycled in, my day off. I had a really busy week filming, doing all sorts of things, which if I've got some time, I'll let you guys know. But what was I going to say? Yeah, so, might surprise you guys to think, I'm shocked myself, that I actually want to praise some of the things that the government have done actually in terms of this, because I think for the What Media community to be useful, what we cannot be is so politically biased and jaundiced towards things that we can't actually praise things when things do go right. Because otherwise it just contributes to the noise and it's not particularly helpful. And I think the things that they should be kind of congratulated for really in terms of Spain, very quick decision. You know, we can't have it both ways. We can't say that the government have been too slow to act, too slow to respond, haven't done stuff. But then when they make a snap decision that ironically the Transport Secretary Grant Shapps is caught up in Spain and will have to self-isolate when he comes home, clearly that can demonstrate that that was a decision that was not made where political considerations were made or considered before that policy announcement was made. And also I think the leaks to the press were minimal. Rather at the beginning of this we had lots and lots of leaks to the press, and it was almost as if government policy was being decided as to how it tested in the press. So they should be congratulated for that. The other thing that they should be congratulated for, I think, is this Get On Your Bike campaign, which seems to be mooted. For those of you that are watching and have been watching will know that I've taken lockdown as an opportunity to get fit. And so biking was very important to me once a day during lockdown, and it still is pretty much once a day. Knees permitting. So that's the second thing. I think there is room for improvement, and I think from a point of view in terms of I think it's clear, it might not have been spelt out in the media at the moment, but I think it's clear and it's becoming clearer and clearer for everybody to see and know that this is basically we're going to be living with this for a long period of time to come, okay? And that means we all have personal responsibility in terms of I had to go back today and get my mask because I forgot it. So when I left the house, turned around, I thought, got to go and get a mask. Hey Jeff, how you doing? Hope you're well. I'm popping up to Lincoln in a few weeks actually, so I might pop by and say hello to you. But what was I going to say? Yeah, so I left the house, forgot my mask, went back in and I got it, right? So firstly, that needs strong political leadership from, I wouldn't necessarily suggest that I'd say that in the same sentence as what I'm about to say, but when it comes to Michael Gove, and strong political leadership, that really does mean that when he's in Pret, he does have to wear a mask and lead by example. So that's the first thing. The second thing in terms of room for improvement is I think, as the many police forces across the country have said, they're going to have difficulty policing this, and they're not going to do it. So what that means is it's very much a case of us having to kind of self-police and kind of tell people and all this sort of stuff in terms of wearing a mask. But I think what the government could really help is if there was a national campaign in terms of identifying people that are not wearing a mask for medical reasons, because they're understandably permitted to not. The trouble is, I've seen lots of people wandering around. I know you shouldn't judge a book by its cover, and it's not a case of judging a book by its cover, because it's really using as much as possible the medical acumen and training that I've got. But looking at kind of young, fit people, unless there's a very niche reason, which I'm willing to be corrected on, they should be wearing a mask. And because the scientific messaging for this has been so botched, so many people still think, oh, I'm young, doesn't matter, it doesn't really bother me, doesn't really affect me. And what I'd implore people to consider is, firstly, it will affect you personally, potentially, because as we're learning more and more about this disease, there's the very real possibility that you could get long COVID. And long COVID is essentially an absolute horrible thing that you don't want to get, and it affects people for a long time. So remember back in the beginning of this, people were saying, oh, just get it, don't worry about it, you'll be fine, right? Don't do it. Can't guarantee it. Prevention is the best cure as it stands at the moment. That means masks, gloves, social distancing, washing your hands. I completely agree, Sue. Washing your hands, and when you can't wash your hands, use hand sanitizer, okay? That's the first bit. And then the second bit is, as I said, personal responsibility, just to make sure that when we are out and about, we all take it upon ourselves to protect each other. So that's the personal thing, long COVID. As to why young people should be wearing masks when they're going out and about. And the second bit is they don't really want to, I presume they don't really want to kind of end up killing their mother, father, grandfather, mother, whatever, loved ones. So there's both that personal incentive and also the societal imperative to make sure that people do this. Because if you look at the testing, they're ramping up capacity for testing thanks Claire, I'm glad you agree, I hope you're well. That'd be great, wouldn't it? Government issued card. They don't have the best record of trying to implement cards, do they? Certainly from an identity point of view anyway, but still, they need something, definitely. So the other thing that I was going to say is the reason that we need to realise that this is something that's going to be with us for a very long period of time is how they're ramping up testing capacity to 500,000 tests a day. Okay, thanks very much for sharing. That's very kind. If you really want loads of people to hear this, contribute to the crowdfund, which I'll come on to in a minute. But if you don't want to contribute or you can't, that's absolutely fine. Then you can just like, comment, share. That'd be really helpful. Fine. So ramping up to 500,000 tests a day, to me, suggests that this is going to be with us for a significant period of time. The last bit that I wanted to comment on was just a little bit of an update from my week, really. Had a couple of filming days, two very different. These were for work, and it was a case of how do you do COVID secure filming? Because every single element of our lives is going to have to be COVID secure. So, for me, from my point of view, I'm quite happy going out for my once a day exercise, working from home. I'm lucky I can, and I get that. I know everybody can't. But then equally, I'm not going on holiday. I'm not going out kind of shopping, really, and restaurants. And I get it. I get people have got to support the economy and things, but equally, people have got to make personal decisions as well. And I think people need to be supported in doing that. So just as COVID secure will touch every element of our lives, in the last week, I had a couple of COVID secure filming days, which were very different days, right? The first day had equipment delivered, which was all remote, that we filmed and we used, and that was good. And then the second day was, shout out to Dave, good, absolute legend, wearing a mask, visor, gloves, alcohol gel for a long filming day. I also got the opportunity to be a bit of a runner as well, and lugged up lots and lots of stuff up the stairs, I hasten to add, right? So not in a lift, because we need to think about everything that we do. How can we minimise our exposure to this potentially lethal disease? And it is, okay? I know lots of people will recover, but equally there's a not insignificant number of people that will get long COVID. And what we need to be really, really strong on is getting numbers under control. I saw Layla Moran on Ridge on Sunday this morning, and I was very interested how she was pushing and wanting to say that the government should be saying that they should be aiming for zero COVID. Have they said that? Are they doing that? I haven't heard. I don't know. Because we want to be in a situation where obviously we're not getting spikes as far as possible. And we've had lockdown. It's never been tried before in the history of medicine in terms of trying to control a pandemic. It has done a significant amount of economic damage, and obviously healthcare and economy are intertwined together, and you need to look at both issues in the round. But are we going to maximise the opportunity that lockdown has given us, right? So we're now leaving lockdown, and it's very much, they haven't ruled out the fact that we might go into national lockdown again, but I don't think anybody wants that. So I think we just need to make sure that everybody does what they can to minimise it as much as possible, whether it's shop local, whether it's go out and actually have hand sanitizer on you, and just respect social distancing as much as possible. Just because they're saying it's 1 metre plus and it's no longer 2 metres anymore, if possible to be 2 metres away from people, why not have respect for your fellow kind of citizens, and make sure that if you can be 2 metres away, there's no need to be getting in people's faces. So finally, for the 44 people that are watching, it's a very big day today, obviously, for Watford. Hopefully they don't get relegated, but I'm trying to control what I can control, ultimately. And firstly, not waste some time sitting there watching it, because, I just can't bear it. Get on the bike in the rain, so I'm going to go now, get home pretty quickly. But just before I go, I'd like to mention to you about the crowdfunding. 100% of donations will go towards, apart from the GoFundMe fee, but everything else will go towards Facebook ads. So it'll be fully transparent, fully auditable. I've told you guys already that I've got the kit, I've got the data plans, I've got the knowledge anyway, because I'm researching it as part of my day job. Just let that bus go past. I'm also writing an MD at Hull York Medical School, the role of media in mass communication and global communication during a global pandemic. And this is just a bit of a hobby for me, really. So to make that hobby worthwhile, if you can contribute £1, £10, whatever you can contribute, I'd really appreciate it. I'm also very fortunate. I've had some very big anonymous corporate donations, which is great. And that's fine. I mean, I assume they're corporate unless there's somebody out there that wants to kind of donate quite significant funds. Because I think the biggest one was £870, and we also had one which was £400. But whatever you can afford, it'd be great. It will go 100% to Facebook adverts. Click on the link above, and just basically so we can get this content to as many people as possible, and ultimately save as many lives as possible. So thank you very much for watching. Do have a lovely Sunday afternoon, and I hope next time we speak Watford will maintain their Premier League status, but if not, you know what, it doesn't. I'm sure loads of Watford fans will probably hammer me for this, but it doesn't really matter. I think, in the world that we're living in, if things like Watford happen and we get relegated, it's not the end of the world. So on that note, thanks so much for watching. Take care, look after yourselves and each other, and I'll see you guys really, really soon. Hopefully with Watford as a Premier League team. Cheers, see you later.